All right, ready? $2.80 for the pork, $3.50 for the buttered noodles, $1.50 for the roll, and $75 for butter. It's like you have calorie Asperger's.
That clip was taken from the Netflix film To the Bone, a movie based on the director's struggle with anorexia nervosa, a type of eating disorder. But what exactly are they? Well, eating disorders are mental disorders defined by abnormal eating habits. Such habits may involve insufficient or excessive food intake to the detriment of one's physical and mental health. People with eating disorders can appear underweight, overweight, or normal. Approximately 30 million Americans live with an eating disorder, and eating disorders are the third most chronic illness among adolescent females in the US. There are 4 types of eating disorders recognized in the DSM-5: anorexia nervosa, bulimia nervosa, binge eating disorder, and eating disorders not otherwise specified. Some with eating disorders also suffer from body dysmorphic disorder, which alters the way a person sees themselves. The precise causes of eating disorders are not entirely understood, but there is evidence that they may be linked to other medical conditions. From a biological standpoint, there are genetic dispositions that may cause one to develop eating disorders. From a behaviorist perspective, well, acts such as not eating or just simply being skinny are praised and reinforced, causing one to continuously do it. Environmental influences such as social isolation, parental influence, peer pressure, and cultural norms also play a huge role. Psychodynamic perspectives tell us that unconscious motives may cause one to partake in the behaviors of an eating disorder, while cognitive perspectives say that dysfunctional attitudes about one's appearance increases the risk factors of eating disorders. Examples include dietary restrictions, bodily dissatisfaction, and valuing thinness. There is a lack of evidence about treatment and management, so most of the information we have today comes from clinical experience. Therapies including cognitive behavioral therapy, CBT, dialectical behavioral therapy, also known as DBT, family therapy, and nutritional counseling also help patients in the path of recovery. Medication is also often prescribed to treat co-occurring disorders. There is a variety of different settings for these recovering methods, including community programs, hospitals, and groups. The media often falsely portrays feeding disorders. To the Bone, 13 Reasons Why, and Feed all show anorexia to be a disorder associated with starvation and weight loss that affect young, thin Caucasian females from the upper middle class. This depicts an erroneous reality of eating disorders and even, to a certain extent, glamorize them. These controversial films can be a trigger for recovery patients or cause them to engage in binging/purging behaviors, or in other words, relapse. The first type of eating disorder we'll be talking about is anorexia nervosa, which is characterized by a distorted body image and excessive dieting that leads to severe weight loss with a pathological fear of becoming fat. There are 2 types: restrictive eating and binge/purging types. This disorder isn't really about food. Rather, it's an extremely unhealthy and life-threatening way to cope with emotional problems where thinness is equated to self-worth. Patients control calorie intake by vomiting after eating or misusing laxatives, diet aids, diuretics, or enemas. It may be difficult to notice the signs and symptoms of this disorder because what is considered low body weight. Patients' desires to remain thin overrides their concerns about their health, so they normally don't seek treatment. Bulimia nervosa is characterized by frequent episodes of binge eating followed by inappropriate behaviors such as self-induced vomiting to avoid weight gain. Bulimia is about one's body image as much as it is about food, so it's harder to overcome. The main difference between this and anorexia is that bulimia doesn't aim to control calorie intake. Similarly, patients purge by vomiting after taking laxatives, diet aids, diuretics, or enemas. Self-evaluation is unduly influenced by body shape and weight, and symptoms include swollen feet, sores, and scars. Binge eating disorder is distinguished by recurring episodes of eating significantly more food in a short period of time than most would eat under a similar circumstance, with these episodes marred with feelings of lack of control. One may feel guilty, embarrassed, and disgusted, so they binge eat alone to hide their behavior. This disorder is not associated with the recurrent use of inappropriate compensatory behavior, like purging, but research has shown that binge eating upsets the natural regulation of dopamine in the body, causing it to become addictive. Other eating disorders include pica, a disorder where one craves and eats things of little nutritional value or things that aren't considered food.
At first it was more just like your washing up sponge, household cleaning sponges, and then it moved on to more like inside of sofas and mattresses, anything foam related,
What kind of
sponge
quantities
related.
are we talking about here?
Anything really, any.
So would you like get through a whole sponge,
yeah,
for
like
example?
so some days, on a bad day, I could eat up to 10 washing up sponges.
Really?
It got really severe, and then on a good day, maybe 2, 3, but every day I had to have something.
And the mattresses, the inside of the mattresses you were eating, was that in your own home or
Yeah.
anywhere?
I did consume quite a lot of my mum's sofa.
Oh, bless.
Yeah.
Rumination disorder is a disorder where one unintentionally regurgitates their food and either re-chew it, re-swallow it, or spit it out. We'll then be moving on to feeding disorders, which is defined as a refusal to eat certain food groups, textures, solids, or liquids for a period of at least 1 month, which causes them to not gain enough weight to grow naturally. This is most often seen in children, and there is no medical or physiological explanation for the very small amount of food they consume, or their lack of growth. In the DSM-5, the diagnosis of feeding disorder of infancy or early childhood was renamed to the avoidant/restrictive food intake disorder, also known as ARFID. The criteria was expanded to include adults who limit their eating and are affected by related physiological or psychological problems, but don't fall under the definition of another eating disorder. Types of feeding disorders include avoidant/restrictive food intake disorders, or ARFID. Patients eat a limited variety of preferred foods, which can lead to poor growth and nutrition. It usually starts at younger ages compared to other eating disorders, and boys are more likely to have it. Many experts believe that a combination of psychological, genetic, and traumatic factors can lead to this condition. Treatments include nutrition counseling, medical care, and feeding therapy. Doctors may prescribe medicines to increase appetite or treat anxiety. Symptoms of ARFID can be treated using forms of cognitive behavioral therapy, and working with a clinician can help change behaviors more quickly than allowing the symptoms to disappear without treatment, which, by the way, can happen. Within the media, the cultural idea of perfection is attained by editing pictures before publishing, also known as airbrushing, and this leads women of all ages to strive towards an unrealistic ideal. Now, has anyone close to you confided in you that they're struggling with such eating disorders? If so, do your best to get them help and be kind to them, treat them with sensitivity. Thank you for listening.